TMJ, or now as it's known today, TMD, is an abbreviation for a number of symptoms associated with the temporomandibular joint, which is just the lower jaw joint. There is no universal agreement inside the dental profession why people develop TMJ problems. I believe TMJ originates from inadequate airway, which leads to inadequate facial growth. The face doesn't grow to its full potential. So the soft tissue inside the joints gets damaged or torn as the muscles that move the jaw are not able to function properly. Patients experience a variety of problems with their jaw joints when their bite is not good. They can have mild to severe headaches, they can have neck pain, they can have pops and clicks and pains in their jaw joints, all of which are associated with this symptom called TMD. TMJ diagnosis is challenging. You have to decide if you're treating headaches that originate in the muscles. You have to decide if the clicks and pops in the joints can be resolved or if the patient has to learn to adapt to them. You have to decide how much pain alleviation you can accomplish without medication. The diagnosis is challenging, and then the treatment requires a lot of patience. Our objective in treating TMJ is to reposition the jaw so the soft tissue in the joints can function normally with no pain. And in doing that, we anticipate that we should be able to relieve headaches and neck pain. Some TMJ patients get well right away. Some TMJ patients don't get well right away. We tell the patients that we treat that we expect them to have at least 80% symptom resolution within 90 days of when we start treatment. And as a general rule, it does happen that way. The treatment of TMJ is very case specific. We decide how we want to determine records and jaw position based on a very thorough examination of each patient and a thorough review of their symptoms. Once we know how we want to treat, we'll take impressions, we'll take a very careful jaw positioning record to fabricate an appliance. All of the appliances are custom fabricated and fitted for each patient. This is one example of a TMJ appliance. TMJ appliances are designed to reposition the lower jaw to take pressure off of the jaw joint and allow the muscles and soft tissue to do their job with no pain. Depending on the severity of the case, some TMJ cases we think that we can resolve and cure. Most cases we don't think can be cured, but we do think that we can eliminate symptoms. For some patients, that means wearing a mouthpiece for the rest of their life. For some patients, that means going through orthodontic treatment. And for quite a number of patients, that means building up their back teeth with crowns so that the joints can work better.
With TMJ, sometimes your jaw will lock on you and you'll have constant pain in here. And I had it so bad that it was making my ear hurt, like severe sharp pains going in my ear. Sometimes you can't open your mouth up very wide. I can't chew gum. I can't bite an apple. If I were to eat an apple, I have to slice it to eat it. But that's one of the problems with TMJ. You can't eat anything, chew or eat anything that's hard because it will irritate that TMJ. Once the appliance was received and I came back for to place it in my mouth, I could tell a big difference then. I honestly could. My teeth feel like they were together, but they matched like they should. And after that, I have not had any more TMJ. It's just something very simple and easy to use. And Dr. Clements is a very professional individual. He's very kind and caring. He goes to the extreme to find out how he can help you with your TMJ or any of your dental problems you're having. Like I said, he's very professional. He's kind and caring, and also his staff is an excellent staff. They're like family to me now because I have been coming here for quite a while, and I recommend them. I recommend Dr. Clements as a dentist.